Maybe this sounds familiar. Your hands start to shake, your heart races, and even though you know you studied, the second that exam starts, your brain goes completely blank. Test anxiety is incredibly common in nursing school, and it can mess with your confidence, your grades, and your well-being. That's where Rula comes in, R-U-L-A. Rula is a mental health care platform that connects you with licensed therapists who actually take your insurance. They accept over 100 insurance plans, and sessions can cost as little as $15. Even better, you can get matched with a therapist based on your needs and goals, with availability sometimes as soon as tomorrow. There are no wait lists, no confusing paperwork, just real, affordable care designed to help you feel more in control before, during, and even after that next exam. Thousands of people are already using Rula to get affordable, high-quality therapy that's actually covered by insurance. Visit rula.com/nursemo to get started. After you sign up, you'll be asked how you heard about them. Please support the show and let them know I sent you. That's rula.com/nursemo. You deserve mental health care that works with you, not against your budget. Well, hello, I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing Podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes that I release on Thursdays. So for this week's Monday Minute, I'm talking very quickly with you about post-op fever, 5 common causes, and you may hear these referred to as the 5 W's of post-op fever. And they are wind, water, walking, wound, wonder drug. Okay, so what exactly do these mean? For wind, we're looking at lungs. We're looking at the patient waking up from surgery, not taking deep breaths, and basically getting atelectasis and potentially even pneumonia. So post-op fever related to lungs, super common. Something you can do is get your patient up, get them moving, get them using that incentive spirometer. The next W of post-op fever is water, and that refers to UTIs. UTIs can occur in the postoperative setting because patients may have had a catheter utilized during surgery. Now, these days, we're real good about taking those catheters out. In the olden days, when I started being a nurse, patients had catheters and they were just in, and we all thought they were great because we could get accurate I's and O's. Patients didn't get skin breakdown if they were incontinent, what have you. But guess what? We saw a lot of catheter-associated UTIs, and that can drastically affect your patient. They can get very sick from that, increased length of stay. Patients can even get sepsis and die from a UTI. So another reason for a post-op fever could be a UTI, also known as water. Next is walking. And when we're not walking, we have a higher risk for a DVT or deep vein thrombosis because our patients are in bed, they're immobile, especially patients who've had very extensive surgeries or, some kind of surgery where they do have to have bed rest or something like that. So the key here is to utilize any kind of DVT prophylaxis that you can, like SCUDs, for example. We don't want our patients to get a thrombosis, and there is a connection between deep vein thrombosis and fever. So we definitely don't want either one of those things. So we're going to get our patients DVT prophylaxis, whether that's heparin or enoxaparin and SCUDs, and doing ankle pumps when in bed and getting up and moving around as much as they possibly can. The next W of post-op fever is a wound, and obviously it's because wounds can get infected. So we're keeping a really close eye on our surgical dressings. We're keeping them clean, and we are treating the patient with any antibiotics if they've been ordered any prophylactic antibiotics. And another cause for potentially infection after surgery would be hypothermia. The body is not able to fight off infection as well when we are too cold. So if you have a patient coming out of surgery, we want to get them warmed up back to a normal temperature as soon as we possibly can. And then the last one is wonder drug, and this is drugs that can actually cause a fever. Some anesthetic drugs used during surgery can cause patients to develop a post-op fever. So can blood products and medications that the patient could have a bit of an allergic reaction to, such as antibiotics. So there you have it, your 5 W's of post-op fever. Again, those were wind, which is the lungs, want to keep the lungs open and functioning well. Water, which is their UTI risk. Let's try to mitigate that. Walking, which basically is lack of walking, which can lead to DVT, which can cause a fever. Wound would be that infected wound. Let's stay away from that. And then wonder drugs that can cause a patient to have a fever. So next time you're asked this in clinical or on an exam, or you're just taking care of a post-op patient, you will sound like you're way on top of your game. I hope this shorty episode helped you, and I will see you again very soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.